the fact that this discussion, this debate around Medicaid cannot be done in a vacuum. We have limited resources, and we must reflect upon the broad array of competing priorities that affect this state's ability to move forward, to invest in an economy that will matter for generations to come. With that, I'd like to open it up to questions, and certainly given that we have our natural resources agencies here, certainly to the extent that you want to focus on those, I would encourage that.
Mary, I have a question. You've spoken before, as the governor, and I think some others, about this group of people. Sometimes it said 3,100, sometimes more, elderly, developmentally disabled, not getting all the services they should get. Have you had a plan? Do you have a plan to provide the money to give them those services?
So let's be clear, the governor has already put over $10 million a year in his last budget to reduce the wait list. There are still today over 3,000 individuals, both in terms of the elderly and the developmentally disabled. The fact of the matter is, there will be more than $18 million available in the Medicaid budget beginning in state fiscal year 16 if we do not expand, that can be targeted to further reduce the wait list and support our most vulnerable.
Mary, you mentioned
and that will leverage additional federal Medicaid support, yes. Steve,
hi.
How are you?
I'm all right.
Good. Good to see you.
You too. You mentioned the subsidies on the exchange. Do you have any numbers about how many people would qualify for these subsidies?
So it's a great question. There are easily more than half of those eligible for the expansion that would be eligible for subsidies. But let's also focus on a point here that for those under 100% of the federal poverty level, while the ACA has not been adjusted to reflect the Supreme Court's decision that Medicaid expansions could not be mandatory across the country, they failed to go back in and ensure that people who are under 100% of federal poverty are entitled to subsidies in the exchange. It's clear by some of the policies coming forward from the federal government that for those who apply, who may not earn more than 100%, the consequence doesn't appear to be a part of the policy. So I would argue that many of those who also will earn less than 100% will also be eligible for subsidies in the exchange. We certainly would urge the Congress to fix that problem in the Affordable Care Act as well.
Commissioner, could you talk about managed care organizations, the proposal within Senator Cates's bill as compared to the accountable care organizations that the department's already doing?
So the fact of the matter is, healthcare providers have strongly encouraged us to ensure that when we make investments in healthcare reform, that we support local efforts that are already underway. Why, they've asked, would you pay a managed care company to hire nurse care managers, pay them, when we're hiring nurse care managers and case managers today in our practice, and you've not afforded us a reimbursement level to account for those additions in our practice? We made the concerted effort to support that local investment in primary care. These for-profit managed care companies are not proven, based on national studies, to actually produce meaningful savings related to how healthcare is utilized. National studies point to the fact that where they produce savings is in states that have higher reimbursement rates. They come in, they cut provider reimbursement rates. We cannot afford to have companies coming in here and cutting the rates being paid to nursing facilities that are already financially vulnerable. We do not see the value add, and worse, we see added duplicative costs with for-profit managed care companies coming into the state when much of the work needs to happen locally. How you affect whether someone uses an emergency department or we can prevent an avoidable hospitalization is the relationship between that patient and their physician and a nurse care manager, not a phone call from Arizona.
What's your reaction to Senator Cates and Senator Saville supporting our Medicaid expansion? How concerned are you now about that?
I think it's unfortunate that we're going to try and fool people into believing that these two issues should be linked. If we want to have a robust debate about how best to today manage the cost of this program to meet the needs of those on it today and the anticipated demand from a rapidly aging population, let's have that discussion. But let's not join it with a discussion about adding over 100,000 people to the program. You simply cannot mask the amount of costs associated with that and argue that managed care will resolve all of the ills, produce enough savings to cover the expansion costs, the cost of the wait list, and our anticipated costs from future demand. It's nonsensical.
I had a question for Commissioner Kelleher, just about the, you mentioned the juvenile lobster surveys. Are you talking about the juvenile lobster settlement survey?
Settlement survey.
Where's the funding for that?
We have other special revenue accounts that we have within the department. We take in about $2.3 million a year in license revenue, but we only retain about $700,000 of that. So it goes back to the general fund. So we become heavily dependent. The department's still heavily dependent on the general fund. I think we receive around $9 million.
$9 million from general fund.
Yeah.
Is there grants from NOAA associated with that?
No, there's not. We do receive some funding for the interjurisdictional fisheries line from NOAA. It is a small amount of money that's spread amongst all the coastal states, and we use that to match funds, usually from the general fund for those particular positions, which become very vulnerable. If it wasn't for Senator Collins, we would have lost that line item. The President had zeroed it out in the last budget. Senator Collins really restored it.
I guess while we're doing, I don't want to dominate this now, but Jessamine, I had a quick question for you about the, is it the surface oil cleanup fund?
The Maine Coastal and Inland Surface Cleanup Fund.
Okay. Is it the surface one or the air? There's in there too?
There's the groundwater fund.
Groundwater. And do you have an accounting of monies that have been swept out of that account and how they've been spent?
Yes, I do. Over the past 10 years, the groundwater fund has been, it's $2.7 million. And then the surface fund was just nearly $1 million.
And has any of that money been used to pay consultants, the mining consultants, the mining regulations?
Not that I'm aware of.
Other questions? Is there any sort of plan for the people that still don't have access to health care? You know, for some of them, they say, you know, they want to get a job, but they can't find one. So is there any sort of plan to sort of, you know, if Maine doesn't want to provide Maine care, what else can the state do to help them get what they need?
Well, again, many of these individuals are eligible for subsidies in the exchange. We cannot lose sight of that. That is purchasing a commercially oriented product that will pay at higher rates to providers. But you pointed out, I think, an important fact here that will be reflected with discussions with other commissioners, and that is how people get meaningful employment. And yet we know that we've not made a consistent investment in our career centers. I am working today with Commissioner Paquette to support individuals in our TANF program to help them with education and training and meaningful employment. And yet those career centers are understaffed and under-resourced. We should be looking exactly at our efforts to support employment and job creation. Other questions? Wow.
One more. Is there any...
As long as it appears in your story.
Is there any appetite within the administration to pursue a private option of Medicaid, which we've seen in other states?
You know, I'm glad you asked that, because I think a lot of misinformation out there about what is in fact a viable option. A lot of the states that have put forward their creative solutions have been ultimately watered down by the federal government. Arkansas is redebating in their legislature, has not been able to get a vote to pass their proposal again at the legislature. Efforts to add cost-sharing, co-pays, have been stripped down, watered down by the federal government. And the issue of a private option, again, the fact of the matter is Medicaid programs historically do not pay the fair share of costs to providers. So when a state says we're going to commit state resources to purchasing coverage in an exchange and with a private auction, the expense of that is far greater. We need to be looking at leveraging what is already available through the provisions under the Affordable Care Act related to subsidies and supporting that pathway. One more question. Come on.
Besides the waiting list, what other areas in DHHS will be impacted if the state expands? Where will you have to cut?
So, one of the areas that we haven't talked about here is our workforce. The Department of Health and Human Services is an amazing department with an incredible mission. And yet we've not supported our workforce in a way, both through the wages that we pay, their salaries have been frozen for years. Our recruitment and retention is hampered by that. We will not be able to make the kinds of investment in that workforce to support the mission, again, when these types of resources are drained away to further fund an expansion. Data systems were mentioned earlier. I need the ability to look holistically across all our programs at how we are serving in an integrated way our families and the individuals that we serve. I have siloed, antiquated data systems that absolutely prevent that kind of efficient, effective, and integrated approach to managing our services. We need significant investments in those systems. I believe that's, do we have one more, Adrian? Or can we do it one more after?
Sure.
Okay. Well, thank you all. Appreciate it.